Good afternoon, everyone. We're just probably giving individuals about 1 minute to get in, and we will start shortly. All right. So, good afternoon, everyone. My name is Station Let Frederick, and I'm the member of the York University Alumni Board and the CEO of Big Brothers Big Sisters of Toronto. And I will be your host for today's event. I'd like to take a moment to acknowledge the land that I am on. As this event is virtual, we will all begin with York's multi campus land acknowledgement. First Nations people have lived on this part of Turtle Island for many years, stewarding the land, the water, and all that contributes to life in this region. Today, the culture and presence of First Nations, Inuit, and Métis people enrich the lands and people of this territory. More than 2 centuries ago, the Mississauga people welcomed settlers to this territory, providing sustenance and engaging in trade and commerce. Today, York University campuses are located on the Toronto Purchase Treaty number 13 lands and territory of the Mississaugas of the Credit First Nations and the lands of the Anishinaabe and of the Williams Treaties First Nations. Our campuses are also situated on the traditional territories of the Huron-Wendat and the Haudenosaunee. The treaty history is foundational and is our collective responsibility to honor the land as we honor and respect those who have gone before us and those who are here and those who are yet to come. We are grateful for the opportunity to be learning, working, and thriving on this land, and we commit to learn the truth and be active in the process of reconciliation. I want to extend a warm welcome to everyone who is joining us today for a special National Volunteer Week webinar, The Surprising Benefits of Volunteerism. Leading today's discussion is our alumni guest speaker, Dr. Pamida Handy. Dr. Handy is the professor of not-for-profit studies at the School of Social Policy and Practice at the University of Pennsylvania, where she also previously served as the director of the PhD program in social welfare. She is known for research that deepens understanding of why people give, serve, and stay engaged, and how their behaviors benefit both individuals and communities. Her research highlights evidence that civic engagement is both socially valuable and personally rewarding. For today's conversation, Dr. Handy will deliver a 20 to 25-minute talk. Then we will take questions from you. As always, we ask that your comments be relevant and respectful. Just another piece is that while we are in a virtual environment, and I know that many individuals may be doing multiple things, we do ask for individuals to be on screen, but we also understand if you are not. There would have already been a notification from Zoom that this recording this session will be recorded, but we will make various attempts when there's a Q&A to respect people's confidentiality. So I welcome Dr. Handy. The floor is yours.
Thank you. And thank you for your kind welcome and remarks. I'm really looking forward to this and the opportunity to speak with York alumni and friends. It's really an honor to be here, and I'm grateful and I'd love to share the research that my colleagues and I worldwide do on pro-social behaviors and the impact on individuals, organizations, and society at large. But before I actually start my presentation, first of all, I want to share my screen with you, and I want to show you this red pill. Can you see a red pill on the screen? And if I told you that you could take this red pill and live longer, have better physical health, have better mental health, it would increase your career opportunities. You would learn new skills, you'd make more friends, you'd increase your social support systems, and you'd increase your life satisfaction. Would you take that pill? If you're hesitating, I understand it, but I want to assure you that governments all over the world actually, these are the benefits, right? And the governments all over the world, and it's FDA approved and approved by the Canadian Medical Association, I guarantee you. Governments around the globe approve it. They encourage it. They subsidize you taking this pill. There are no harmful effects, and it's not addictive. So there you are. I'm going to leave you with that question as I go into my talk. And you can keep that question at the back of your mind. I will come back to it in a little while. So this is the National Volunteer Week webinar. And today I'm going to talk about the very surprising benefits that most volunteers probably don't know, but they enjoy in their volunteering. And as Station introduced me, and thank you, Station, I'm a professor at University of Pennsylvania, and I'm a proud York alumna. Why am I a proud York alumna? Because I spent over 25 years at York University when I came to do my master's in mathematics, then switched to environmental studies, then did my PhD at York, and then became a faculty member in the Faculty of Environmental Studies, which I think is called Environmental and Urban Change now. And then I got married. My husband was in Philadelphia, and we made a deal that whoever gets the first job would move. I ended up getting the first job in the U.S., so now I'm in the U.S. Anyway, so that's a little introduction of why my roots are very firmly attached to York University and why I'm particularly happy to be here giving this talk to York alumni. And so thank you for inviting me, and thank you for arranging it. So my research started with puzzles. Like I did economics where people think people are self-interested, profit maximizing, and so on. So I was very puzzled that in this country, in North America, people work so hard to make money and then turn around and give it away. And if I asked each of you, do you have free time? You'd say, no, we're stressed for time. I've got X to do and Y to do and Z to do. And yet you turn around and volunteer. So this was a puzzle for anybody from economics thinking like, what's going on? So this is my focus on all kinds of civic engagement, particularly on charitable donation and volunteering. And why volunteering? How did I come to volunteering? Because I often like to know how speakers get to the areas that they focus on. So I'll tell a little small vignette. When I was in high school, or when I was just finishing high school, I did my last year of high school under a scholarship program called the American Field Service, where I spent an entire year in San Francisco area as a high school student, and I graduated from high school there. My American mother said to me one day, would you like to donate some of your allowance to some children in Africa to buy them books? I had $14 a month, and I was not going to give up any of it. No, not really. I hummed and I hawed, and I said no. $14 a month, of course, went a little bit further than it does today, but still it was very meager. So then the next week she asked me, how would you like to volunteer? And I said, well, what is volunteering? Then she told me what it was and that I would go to a hospital and give out books and take the library card from room to room and talk to people. And I would wear a pink and white striped candy uniform. I would be called a candy striper. Well, at 17 years old, that kind of pink and white striped candy uniform made sense to me, appealed to me, and I started volunteering. Coming down 50 years later, who knew that the rest of my life would be focused on people volunteering. So that's how I got to this idea of volunteering and through the puzzle that I just talked to you about. So now I want to talk about volunteering. But before I do that, I want to make sure that we're all on the same level playing field. What is volunteering? So I looked up the International Labour Organization's definition in 2013, and they said people of working age who during a short reference period performed any unpaid, non-compulsory activity to produce goods and services for others. In other words, you couldn't do it for family members or somebody in your household. It couldn't be compulsory like court-appointed volunteering or graduation requirement of 40 hours of community service. Nor could you count something that you were using as an internship as a trainee. So this was work performed to help the public good or the common good and for people not within your family. So that's the kind of work I'm going to talk about. And what does it help? So the question is, why does volunteering matter? It matters in so many ways. It matters that many of our organizations that we know today wouldn't exist without volunteers. It matters because it is the social glue that bonds us together. But what does it do for the individual? What about the person who actually goes out and volunteers and gives up their time for the benefit of others? Okay, so let's look at some of those. So I will eventually come to the organization and community level, but I'm going to focus now on the individual. So here's that red pill again. So there's a lot of scientific evidence. When I give you this, there's a lot of scientific evidence that backs it up. And if anybody's really interested in that literature, I'm very happy to share it. If you would send me an email and I could share the literature with you. So studies show that volunteering improves mental, physical health, reduces stress, and predicts a lower later mortality risk amongst older adults. So it increases social connections. We show that you meet like-minded people, you build friendships, you expand your social networks, and not just amongst your little circle of friends, but these are bridging networks that connect you to people that you would normally not connect with, and have meaningful interactions because you're all performing the same kind of good that you like, which are really precursors to meaningful relationships. Their career opportunities, skill development. You learn new skills when you volunteer, leading to better jobs, providing networking opportunities, gaining work experience for leadership, teamwork, communication, problem-solving skills. Volunteering can also strengthen people's resumes. Students who apply to get admitted to my university have, long lists of all their volunteering activities because that helps us to know people better, because I can tell you I'm trustworthy or I'm committed or I'm motivated, but that's kind of cheap talk. But if you see on my resume that I've volunteered, it has a signaling effect. It signals desirable traits like kindness, cooperation, which influence not only employability, but also mate selection. You'll see on many dating sites, people will put up whether they volunteer or not. There's a sense of personal fulfillment, which I think is really important because it gives people a sense of purpose in their lives, about making a difference. And so volunteers feel time rich. That's back to the puzzle. We ask people who donate and people who volunteer whether they feel that financially or otherwise satisfied, more satisfied. And they're certainly more satisfied because you feel you have a surplus to give. Some particular health, when I say health, it's higher psychological well-being, better cardiovascular health, lower coronary health diseases. People who volunteer are more likely to take preventative health care and spend fewer nights in hospitals. And a meta-analysis means that somebody put all the research together and they did a meta-analysis and they found that for older adults, it predicts a lower mortality risk. People live longer. And they're happier too. And these findings are not explained. You might think that, volunteers are already healthier, happier, well-connected people. No, we control for all of this. It means we take out how your demographics, how your gender, your race, your income, your education, all of these, how they affect your health. We remove those effects and we still find robust effects of volunteering. We remove people's health levels or functional health levels in their previous illnesses, and yet we find these results are very robust. And so even controlling for all of these prior things that we know affect people's mortality and health, we still find that volunteering has beneficial effects. Then there was a study which I have to share with you in a little more detail, and I'm going to read this because this is not my area. It's people who do genetic work and biology and so on. They asked the question, does volunteering frequency affect biological aging measured through epigenetic age acceleration? So they look at something in your genes and your DNA, and there's something that's your chronological age and something that's your non-chronological age, and they look at both of these things. So epigenetic age acceleration refers to a person's epigenetic age, or the biological aging measured by your DNA methylation. If it's older than the chronological age, it indicates that you're aging faster. So some people who are 40 that look like 20, and some people are 20 that look like 30. If epigenetic age is lower, it suggests slower or healthier aging. And it's influenced by many factors, clearly with your genes, your environment, your behavior, whether you smoke, all kinds of things can affect your epigenetic age. What they find is that volunteering is associated with reduced epigenetic age acceleration as measured by your DNA. This study looked at a large number of a nationally representative sample data set of older adults with rich biological measures. And then they looked at people who volunteer and people who don't volunteer, and they controlled for everything else. And they find that higher levels of volunteering and sustained volunteering are significantly associated with second and third generation clocks that are trained on morbidity, which is sickness, and aging. And they find that moderate levels and high levels of volunteering reduce people's aging. The aging process was slowed down, and the relationships were stronger for retirees as compared to working counterparts. That's the finding. Then the study is noted down there. So volunteering could be a very low-cost, accessible intervention to promote healthy aging. And this supports policies that encourage civic engagement amongst older adults. And we know that this is true in many, many countries where governments have actually put in policies to encourage people to volunteer. So do volunteers live longer? So what are some reasons why? We don't really know the reasons why. I mean, this is one of the very recent studies that looks at the biology and your DNA and so on. But some of the reasons could be social integration. We know that when people are isolated, they don't live long and they die from isolation. Isolation is a major mortality risk factor. When you're volunteering, and especially when you go in-person volunteering or even online, we find that people develop relationships and there's less isolation. There are clearly psychological benefits. It gives you a greater purpose, meaning, and self-worth. And this can lower depression and stress. And there are certain behavioral pathways. You stay more physically active, especially if you're going in to deliver Meals on Wheels or whatever it is you're going to do. You maintain routines, like every Wednesday I need to get up and do this. And this is very important as you're getting older. And remember that for many people, as they get older, they lose certain hats that they wear, like a parent. When you were a parent, you had a purpose in life. You had to bring up your children. When you were an employee, you were working, you had a purpose to get up and go in the morning. As you retire and as you get older, you lose these roles. And having a role is really, really important. And volunteering sometimes fills these roles for people. And in a way where when you give back to others, it also gives you a sense of purpose. And so it can help reduce physiological stress responses. And from an economic point of view, it gives also you a positionality, because we know that in economics, people are happier when they are richer, for example, but then they only want to be richer than their brother-in-law. It's not like I want to be at the top of my little group, I want to be at the top. So when you go to volunteer, just think whether you're giving in terms of strength, Habitat for Humanity, whether you're giving tutoring, whether you're giving some kind of resources, you're better off than the person getting it for that time being. And I'll give you an example. I used to go, and I still do it, volunteer for Ronald McDonald's house. And then I would sit there, we would cook meals, we'd serve it to the families who were there. And then they would talk to us about their stories, about their children who were young and who were suffering from. And I would think, there, but for the grace of God, go I, because my kids are healthy. That is a positionality problem where you're not only grateful, but you feel better off. Right? And this is an extremely important way in which we find a sense of purpose, because you're doing something good, but you're also feeling that you are better off, and that whether you believe in God or not, but for the grace of luck or God, you are better off than other people. So these are some of the pathways. Now, the other thing I want to turn to, there are many other benefits, but I'm going to look at employability and earning. So many people are interested in getting jobs and they're earning. So volunteering can also lead to acquisitions of skills and work-related experience. So the human capital theory says that you're more likely to be employed and make more money depending on your human capital, and that you get through education and work experience. It extends your social networks, according to which well-paying jobs are partially due to having social networks, because you know somebody who tells you a job is available or recommends you for a job. And by volunteering, you increase your social networks and the probability of getting that kind of thing. And then you can signal ability, as I told you earlier, employees' worth. So I can go for a job interview and tell you that I'm very reliable, I'm honest. Right? But that's kind of cheap talk, as I said earlier. The fact that there's volunteering on my resume might signal these qualities that are unobservable to the person who wants to employ you. In fact, there is a survey done on LinkedIn, and I think you're all familiar with LinkedIn. It's a site for professional networking in over 135 countries. And they recently asked their members to list their volunteering on their LinkedIn page. And why is that? Because they showed it's a really reliable signal. They found that 41% of employers rated volunteer work as equal in importance to paid work when selecting new employees. And 1 in 5 based their recent hiring decision on a candidate's volunteer work. So this is a lot of evidence that shows there's some really surprising benefits. I mean, maybe you all know they're not surprising to you, but they certainly, if you stack them all together, you can see volunteering has a lot of benefits, both for society at large and for the individual. So here's some actual evidence on earnings. And there are studies done by people in Canada where volunteers earn 4 to 7% more on average. And of course, there are gender differences and professional differences and so on. In Austria, they earn approximately 18.5% more than non-volunteers. In France, it's kind of mixed because there's positive if you work in the public sector, not so in the private sector. In Italy, it's about 3.3%. In the UK, the increase in earnings only for professional and managerial workers, not so much for white or blue-collar employees. So highlighting that there are some occupational differences. But if these are annual wage differences, then you can understand that over a lifetime of earnings, this can certainly add up, right? When you come to Canada as an immigrant and you look for work, people always ask you for Canadian work experience. And this is kind of a vicious cycle. How do you get Canadian work experience without a job? And how do you get a job without work experience? So what Volunteer Canada does, and this is a government supported, it asks new immigrants who are coming in to volunteer and tells them, this is taken right from their website, and the benefits of volunteering they list for you. You develop new skills, you participate in training opportunities, you meet new people, make new friends, you find out about your community services, you gain this Canadian work experience through your volunteer hours, right? And you can volunteer in multiple places. If you have language problems, there's a great place to improve your language skills. You can add it to your resume, and you can understand of Canadian culture. What is the culture like? What do people expect here? You learn all that, and so newcomers. So it is in a paper that we wrote. We called it as a stepping stone to integration for many newcomers, immigrants and refugees. Then we did two very recent studies I want to spend some time on, and I'll be a little brief on these studies. And I did it with my colleague Sarah Conrad, who's a social psychologist at the Indiana University, the Lilly School of Philanthropy. And we did one on voting, which was just published, which I'm very proud about, and the other one on the good-looking giver effect. So in brief, we find that voting behavior, if you think about voting, I will tell you, is the most altruistic act you can do. I know some of you think it's your civic duty and you do it, but you have to go to a voting booth, or you have to register for remote voting in whatever ways. There are some costs to it. And unless you believe that your one vote can change the elections, this is the most altruistic act you're going to ever do. You get nothing in return except a good feeling. So we looked at people who vote, and we looked at a longitudinal study. That means we followed people for many, many years, and we tracked adults who had voted in the 2008 presidential election, and then we compared them to those who hadn't. And then we examined participants' risk of dying over the next 5, 10, and 15 years. And this is what we found. There's a long-term benefit. So voting is associated with a significantly reduced mortality risk 15 years later by 25 to 30%. Okay, you're thinking, the healthier ones that go to vote, they already, but we control this. We took all those covariates, all the education, previous health conditions, income, all of that, we controlled for it. In fact, without the controlling, it was 43% lived longer. After we fully adjusted the model, it came down to 26% to 30%. So when you include all those covariates that could explain why people live longer, we still find that there's a long-term benefit for people who voted. And what's interesting, it was regardless of how you voted. You could have voted remote, and you could have voted in person. And more importantly, it didn't matter whom you voted for, whether your party won or whether they didn't win. It had nothing to do with the results. And we have this from verified voting records. It's not from people reporting that they voted. We have verified voting reports, and then mortality, while they're dead or not, that's pretty unquestionable. And we still find that these results are very robust. But being scientists, we have to sort of hold caution. These findings were based in a Midwestern white American older adults, so I can't generalize it to everybody. So we don't know if it holds for all populations. And causal claims, we cannot make causal claims. Even though we studied them over time, causal claims, we can't say one causes the other, because there may be something else that is in play that as researchers, as scientists, we don't know. So we always make a caveat that we can't generalize this. And the second surprising effect we found was based on this particular statement. He who is fair to look upon is good, and he who is good will soon be fair. So we have this halo effect. When somebody's good looking, we think, they have better qualities, they're more intelligent, they're trustworthy, they're more likely to do pro-social behaviors. There's a lot of literature in economics that looks at the halo effect. And you just have to think of all the movies you see. Always the villain is ugly and the hero or the heroine is handsome or beautiful, right? So we just attribute good qualities. But what we wanted to study is the reverse halo effect. It's a cognitive bias where observing a positive behavior, like somebody who's volunteering, somebody who's donating, somebody who's helping others, does it lead us to assume positive qualities as they are being more attractive? And we do find this good-looking giver effect, that more physically attractive people are more likely to engage in giving behaviors and vice versa. More people who engage in giving behaviors are also rated positively. Now, you're going to say, how in the world did you do this? Well, we had yearbooks of people from 1950. We followed them from this data set. We didn't follow them. This data set is publicly available to anybody who wants to do the research. From when in Wisconsin they were teenagers till 2011. So they looked at pictures in their yearbook, and there were raters who rated them attractive on an attractive scale, whether they were attractive or unattractive. Then they were asked questions: do they give money? Do they volunteer? What are their pro-social behaviors? And we find that those who were rated attractively were giving, more likely to give money 40 years later as compared to their less attractive peers. Then their pictures were taken later, 13 years later, and people who were answering the questions or asking the questions didn't answer the attractiveness. Somebody else rated the attractiveness of the people. And we found that interviewers, that non-given, the people who were pro-social were more attractive 13 years later than those who were not pro-social. So the key findings are individuals who help and engage in helping behavior are perceived more physically attractive, and the effect again persists when we control for income, age, previous health conditions, and all of the other things that could make them better looking. So, final question. Why are so many people volunteering? We know that something like 2/3 of people volunteer both formally and informally, both in Canada and elsewhere. And I don't know how my time is, but can you somebody tell me how am I doing for time?
You have less than 5 minutes.
Okay. So what's interesting is that motives matter why you volunteer. If you're volunteering for instrumental motives, for example, if you're volunteering because you know it's going to look good on your resume, or some other instrumental motive, versus if you're volunteering because you really want to give back to society. And again, we look at a longitudinal study, and we find that motives matter. That if you're not volunteering to give back to the community, we find that when we run a logistic regression, that controlling for all of these things, we find that self-oriented motives, you'd find no reduction in mortality risk. Other oriented motives, when people say they want to help others and they're doing it for altruistic reasons, significantly lowers mortality risk even after controlling for covariates. So people ask, why won't you tell gerontologists or doctors to ask their older adults to go and volunteer? Yeah, we want to ask them to go and volunteer, but we're not going to tell them it's good for you, therefore you volunteer. It should be something like, it's time to give back to the community. You want to go out and help. This is your time. You have time to go and help. You don't want to ask them to volunteer because you're going to think, they're going to live longer, or they're going to be happier, or their cardiovascular health is going. We find that it is important what happens in your brain, what serotonin and all those other things that really matters. The motives matter. So why you go and help others. And with that, maybe I should close on before I go to the macro level. But I think you can think for yourselves of all the organizations you're involved with, including York University, whether you engage there as a volunteer or not, whether you engage as an alumni, or whether you engage in society. So I will come back to the first slide. Are you willing to take that red pill? Are you going to take that red pill and enjoy the benefits? So thank you very much, and I will turn it over to you guys to ask me questions.
Thank you so much, Dr. Handy, for that insightful presentation. As someone who runs a volunteer-based organization, Big Brothers Big Sisters of Toronto, hearing some of these pieces around the benefits, we hear it's anecdotally about the impact around volunteerism. So it's good to see that there's data that sort of validates some of those sort of anecdotal pieces that we're here